Good evening and welcome to Thursdays with NAMI. I'm glad you're here. Thursdays with NAMI is NAMI North Carolina's answer to the COVID-19 stay-at-home era. We can't roam the planet the way we used to do, but we can push back and create safe spaces for connection and positive energy, and that's why we're here tonight. So I'm so glad you all are here. Let's see, May is Mental Health Awareness Month. And what better way to kick that off than to get some words of wisdom from one of our state's key leaders in mental health, Cody Kinsley. He is the Deputy Secretary for Behavioral Health and Intellectual and Developmental Disabilities at DHHS. And that segues perfectly into a word from our sponsors. I'm going to go ahead and share this beautiful logo we have on file. Funding for Thursdays with NAMI is provided in part by the aforementioned DHHS, that stands for the Department of Health and Human Services. That's on the federal level, and our funding comes through the Community Mental Health Services Block Grant Fund. The division has been a steady hand since COVID-19 jumped into the spotlight earlier this year. We appreciate their guidance and support, and I'm actually really jazzed. One of the reasons I'm jazzed about having Cody here tonight is that you could hear me read that statement, because every week we've been saying we appreciate your guidance and support. Truly we do. So for the virtual studio audience, tonight's program is being recorded. If you have friends who couldn't be here tonight, please tell them it is never too late. They can check out this program on NAMI North Carolina's YouTube channel. All right, so now let me read this impressive bio. I'm again very jazzed about having Cody Kinsley here tonight. As Deputy Secretary of the North Carolina DHHS, Cody Kinsley's mission is to achieve a future where all have access to high quality and integrated behavioral health services and intellectual disability supports so that all of us can thrive in our communities. His work focuses on redesigning public insurance, combating the opioid epidemic, and improving operations throughout the delivery system. His policy focus involves trauma-informed care, resilient communities and schools, diverting and treating peers who are involved with the justice system, and increasing access to care. Deputy Secretary Kinsley manages two divisions that together set behavioral health policy. He oversees outpatient services delivered through 7 publicly funded managed care organizations, as well as inpatient services at 14 facilities. All told, he is responsible for over 11,000 staff who serve 3,000 patients and residents. So that is one full plate. Deputy Secretary Kinsley's career has spanned the public and private sectors, including positions at the White House and the U.S. Department of Health and Human Services. He has led operations for a behavioral health care service provider in Western North Carolina. Most recently, he served as the presidentially appointed Assistant Secretary for Management of the U.S. Department of Treasury. He earned his bachelor's degree from Brevard College, right here in North Carolina, and his Master of Public Policy from the University of California, Berkeley. He's a native of Wilmington, North Carolina, native son. Welcome.
Thank you, Peg, so much. It's wonderful to be here with you this evening, and wonderful to get a little time to just relax and talk to folks and check in on how things are going. So happy to be here.
That's great. Absolutely. So I'll start with this question. The COVID-19 pandemic has generated so much stress on so many levels, economic, health implications, and there's the social isolation. How are you and your team coping?
Thanks for that question, and I'll take coping to mean both personally and the work that we have to do in this moment. You know, I think what is really challenging about COVID-19 compared to a lot of other disasters, natural disasters in particular, is that, you know, both the disease itself creates stressors for people in that it presents an amount of uncertainty. It creates fear and anxiety that can grow from that. But also the public health mitigations that are part of this strategy for fixing COVID-19 or trying to flatten that curve to save more lives also cause problems for mental health in that it creates a space for social isolation and other things. And so first and foremost, we want folks to know that they're not alone, that a lot of people are experiencing this, whether they're, early on in any part of their lives, that this is something that's truly touching everyone. And it's been touching our team. I mean, we have a phenomenal team of folks who are incredibly passionate about serving North Carolina, who, very quickly, like the rest of folks, found out that they were either going to work from home or not be able to work because their job didn't lend itself to telework. And so they had to be put on leave. And so it's been very disruptive. I think what has galvanized us and the unique position of being public servants is the opportunity to work really hard in response to this to try to help people. I mean, I think when you think about people who work in government, they're very driven by trying to do the right thing to help folks. And I've had a lot of fun times working in many places, but I've said this since the first day I was here. I'm confident that I have not ever worked in a place where people were more passionate about the work they do than at the North Carolina Department of Health and Human Services, and in particular, the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. I mean, people are in their jobs because they care about the people they serve, and now is a time more than ever to make an impact on those people's lives. So I think a key coping strategy for us is finding that purpose and channeling those efforts to fulfill that purpose. And that's definitely been a big push for us.
Right. It's good to hear you say that. We've certainly had good experiences with the division in terms of our grant negotiations, and we've definitely felt that passion. For example, our community inclusion program, which is kind of new, and what can we do to really give folks with mental illness a chance at feeling a part of their communities on a deeper level, and we really felt that support from the division. We appreciate that. So that passion has come through from our perspective. So, all right, the stay-at-home order is set to expire at 5 p.m. tomorrow. And of course, you don't have a crystal ball. On the other hand, you probably know a lot more than the average bear. How's the future going to look from your perspective, and how long do you think Americans will be asked to limit their movements? Easy question, softball.
Yeah, right. Peg, you're letting me settle into this simply, I see. You're right. It's a big unknown. And I think what is important to know about North Carolina is that we were successful, right? We set out with the goal of flattening the curve. And while we have had, up days and down days of rates over the past several days, we are in a very stable, relatively flattening position, right? We're not seeing that exponential growth that we saw at the very beginning and that we've seen in so many other states, especially concentrated urban areas, play out. We've seen a more stable and flattening of that. And what that has meant is that we haven't seen our healthcare systems become exacerbated. We haven't seen really tough situations where people are struggling to get access to care. But it also means that we still have a sufficient amount of virus in community spread that hasn't really been able to burn out, if you will. We haven't run up that peak. And so I think what we're going to see over the coming weeks is that we will see, as we relax, we'll start to see some more cases, right? And then I think everybody will realize that, and then people will comply a little bit more with the relaxed rules, right? Well, our strategy has been to create a set of rules that allows us to move slowly, driven by data, to be really thoughtful about how can we all wash our hands. Remember, 3 W's. You'll hear me say that a lot tonight. We're really excited about this. Wash your hands, wear a face covering, and when you're in line, wait 6 feet apart from another person. So wash, wear, wait. And if people employ those sorts of hygiene efforts in a really serious way, if businesses partner with us to decrease, then I think we will hopefully see this flattening hold. But I think we'll see it move a little bit as we go through the phases. So really the phases are a bit of a training wheel, if you will, to help us get to a place where we can all adapt our behavior. So really, I guess I push it back to what we will see depends on us, depends on how we all try to comply with that public health measure businesses and individuals as well. But I do think that this is going to be a long haul, right? This is a bit of a different type of normal for folks. And so we're being thoughtful about what does that mean for our behavioral health system? What does that mean for our system of care and how people get access, right? We've got a lot of folks, I think about peers who do a lot of really phenomenal work in our state in working with individuals that are finding their path to, into, and through recovery. How do they connect with folks when it's at a distance, when it's different? And so, and we've got to think through in partnership with folks to think through about how that is, because I think that we're going to feel a different way of living for a long time.
Right, right. There's a lot to that, and I'm glad, I appreciate that sort of thoughtful approach. It is a lot to balance. I mean, the problem and the solution both have side effects and perhaps unintended consequences. Personally, I have been trying to wear a bandana. Typically, if I have a cute bandana, it goes on my dog, a beagle, who you'll see in a few minutes. The one that I had on hand that I could use for this purpose is black, and it has little skulls on it. So not the cheeriest thing, but that's what I have.
That's right. Well, and I don't have mine with me, but we're wearing masks here in the Emergency Operations Center as well, and so we have surgical masks that we're wearing, but you know, good cloth covering is a good place to start. And yeah, you know, it's an opportunity to have a little bit of a fashion statement. Say something about yourself to the world.
That's right. That's right. So I feel like I'm complying with the letter of the law, but not the fashion aspect, but I'll get there. It's a process. All right. Okay. So moving along, it does look to me like folks are complying with the stay-at-home order, just looking at traffic, looking at the number of businesses closed, of course. There are also folks who want to hashtag reopen North Carolina, folks who've been protesting at the State House weekly from the looks of the headlines. And according to their Facebook page, they are, quote, mostly business owners and employees who are losing income and being denied the right to provide for their families. Is there anything you might like to say to them?
You know, I think that their experiences are totally valid and real. I mean, we've had huge numbers of people that have been put out of work, you know, and I think really their experiences are frankly more of a statement about how fragile our economic system was for a huge number of people in North Carolina before this started. You know, we had so many people in the retail and the service sector who were, you know, living on very stretched wages already, who may or may not and likely did not have health insurance tied to that. You know, we have 1 million people in North Carolina that don't have health insurance. And so, and I can't remember the statistics off the top of my head, but I know nationally a huge percentage of people have less than $400 in savings. And that's not a statement about those people. That's a statement about the cost of housing and the, you know, the low wages, the lack of a living wage that people are living through. And so I can respect that folks' reaction to this situation is to be frustrated, and that it doesn't work for them. And I am proud of a lot of the work that our state government has done in attempting to ameliorate and soften some of those painful points with, obviously, you know, a lot of changes to our unemployment insurance program, a lot of federal support to do that. But that doesn't fix the health insurance issue. You know, we still need to expand the number of people that are getting access to health insurance. So I guess I think of it as, you know, this pandemic shines a bright light on a lot of things that I wish we would have already done differently coming into it, right? I wish that more people had access. You know, I've actually been kind of keeping a list of the things that as our team has worked through the things that we've needed to try to figure out to help respond to this. I've got a list of wouldn't our lives be easier if this was already done, right? If we had universal health insurance, that would be great, right? If people, you know, if we had more stable unemployment insurance so that if folks had to be out of work for a period of time, it wasn't going to decimate, right? If housing prices were already, you know, not 3/4 of someone's income or more, if it wasn't so fragile. And so I think about the is the economic system already fair? And I would argue that it is not, which I think we see often as we think about behavioral health, which I can talk more about in a moment. But my long answer to your very wonderful question is that I don't blame anyone for feeling frustrated that these public health measures are hugely disrupting their lives. I have heard enough personal stories from people who, we have a member that's working on our COVID response team, and her grandmother passed away 2 days ago from COVID-19. I mean, there's many people whose lives have also been impacted. And unfortunately, people are reacting to one problem, and unfortunately, I don't believe the answer of blindly reopening is the right one. I think that there is a third way, and that is more support for those folks who are feeling that economic pain.
Right. Yeah, I've met plenty of people who see both sides, and I know folks who worked for small businesses or owned a small business who I think are probably hit the hardest in the business community. And it is a struggle, but it sounds like by following the data and taking a cautious approach, cautiously optimistic, I guess, we'll get there.
Yeah, I think it's going to be a matter of time, and I think that the initial investments in trying to help support people at this really tough time are just that they have to be the initial, and there's going to have to be more, and we're going to have to continue to adapt our policies to make sure that folks can be supported, whether that's individuals, businesses, etc.
Yeah, it's interesting you were talking about how really North Carolina has done comparatively well, and I agree. I moved from Ohio to Raleigh 2 years ago, and I've noticed in Ohio, Governor DeWine is getting accolades almost across the board for handling it well, and I'm not sure I see that same appreciation here in North Carolina. Maybe we're a little harder on ourselves.
Yeah, that's fair. I think that I think it is a different place for sure. There's a lot of different elements that are feeding into that, and I think that North Carolina is a place that has a rich history of having a really vibrant economy with a lot of rich history in manufacturing and textiles, and booming. We're one of the 10 fastest growing states, like yourself, moving here 2 years ago. Me coming home 2 years ago back to North Carolina, people want to be here. That's created a lot of small businesses, but it also makes the situation a bit more complex.
Yeah, absolutely. So I've heard in times of crisis that it's best to over communicate. You used the word uncertainty a little earlier in the conversation, and I think people do need a lot of reassurance, a lot of information in the face of uncertainty. And again, I think DHHS has done a great job of getting the word out there. I've seen you on Twitter, I've seen you on podcasts. The DHHS website is full of information, chock full of information and data. If you had a magic wand, though, is there anything more that you wish you could do?
That's a good question. I mean, I do feel like we have, done a good job at communicating. I think that we early on committed to having, and this goes back to, I think in times of crisis, you go back to your core values, right? And as an organization, one of our core values is proactive communication. And so early on, we set up a cadence of having weekly calls with consumers, weekly calls with providers, weekly calls with LME MCOs, weekly calls with key associations, weekly calls. And I think that what we learned through that, and we learned very quickly, fail fast, fail forward, was that we actually wanted less of me talking and more of us listening. And I think that, and so I guess if I had a magic wand, I would have instituted that sooner. People really drive us to the things that we need to talk about by listening to their questions, and that was good. I wish that if I had a magic wand for 2 wishes, if you'll allow me 2 wishes, Peg, I would say that, I wish that we could more easily reach folks that are either, that maybe are technologically not as proficient, right? I think one of the elements of this pandemic has been that we have really relied heavily on technology as a strategy, just like we're Zooming right now, to try to keep people connected. And yet there's a large number of people who technology is out of reach for them. We know that that's an issue in North Carolina structurally because we don't have the broadband we need in a lot of rural communities. We don't have I'm at the state's emergency operations center, and if I go into the wrong room, I'll have horrible cell phone service, and so there's problems with that. So I think that if there was a second magic wish, it would be to get, those things kind of not as hindrances to us being able to communicate with people.
Right, right. And again, there's always a list of things you wish you could do, no matter how excellent your performance is. There's always more. That's true at NAMI. That's pretty much true anywhere, especially in helping professions.
Yeah, I mean, I think that, the last global pandemic was 102 years ago. So none of us really have much experience in reacting to a situation like this and learning based off that. I think we have all leveraged our experiences in other analogous situations to try to grow from that. And I am really, really happy that we have a phenomenal team of people that have stepped up, a mix of state employees from a lot of different places, volunteers, people from academia, people from other businesses that are all coming together as a really diverse group of folks to try to lead the state's response here. So that's made that our strength is in that diversity, I believe, of experience.
Okay, so I see a note in the chat box, a question, when are you guys going to talk about some mental health issues? So I'm going to move on to a mental health question. You're the boss, virtual studio audience, so here we go with a more mental health related question. We've seen some changes in community mental health due to the COVID-19 crisis. What kinds of long-term effects will we see in the system? Specifically, will telehealth continue to be an option?
Oh, great. It's a great question. I sure hope so. I mean, I feel like one of the, what I'm calling crisis-opportunities of this experience has been that, we had to push our telehealth policies forward. And I have said, and it's been reported, that I believe we've moved our telehealth policies 10 years forward in 10 days time. And that's amazing. And I think that it's a testament to when you have a situation where you must do it and you have a crisis, and you have focus, an incredibly hardworking team, you can get it done. And people really came together to work magic to actually dot all those I's and cross the T's, because trust me, Medicaid and state policies are not easy things to write. And for every provider who's listening, and so I think that, we are committed as the department to figure out a way to keep as much of that really good policy in place. A lot of it will come down to funding, that we've seen a huge jump in costs driven by having it available, but it's a cost that's the right thing to do, but it's just a matter of us, actually getting the state budget appropriation to be able to continue to sustain that. And what I care a lot about is that not only is it that, the state has made that investment to give access to the 2.2 million Medicaid beneficiaries and the million people that are stretched thin in the uninsurance safety net, but we've seen private insurers step up with telehealth policies, not only access to telehealth, which we're kind of saying, don't even call it telehealth anymore, just call it health over the phone, over the video, right? And not only are they providing that, they're providing it where they're paying for it at the same rate that they would pay for a physical health visit, and they're paying for it at the same rate that they would pay for an in-office visit, right? And so making sure that that's on par, that's critical for providers to sustain the service, to make it work. And so I'm hoping that this event will drive leadership among our private insurers, because the need for behavioral health services is not going to just be now. Like, we know that this is going to be, it was already, high in our state. There's a lot of unmet need, and I believe that's only going to get higher in response to this event.
I am thrilled to hear that, and I think telehealth in particular can make such a difference in our rural communities where transportation is so difficult. some of the providers are fewer and farther between. And I know that can be challenging. Technology can be challenging for folks with lower incomes. However, the vast majority do have a smartphone. So I'm really hoping that can make a difference for people who have been isolated and had a real tough time getting access to services.
Yeah, I mean, you know, I think this is an interesting trial period where people are feeling it out and feeling if they're comfortable with it. And I have friends and family members who, you know, are starting a relationship with a therapist for the first time in their lives. And what finally feels comfortable to them is that they don't have to go to that office to go in to do. They get to just go sit in their room and shut the door on their phone and FaceTime with their therapist. And so I think that there is an element of making it more accessible and going through some barriers that are potentially associated with stigma. And so I think I think it's great. But in the end, you know, I don't want us to, you know, the goal is not to move everything to telehealth, period, right? The goal is to make this another tool in the toolbox to increase access.
Mm-hmm, mm-hmm. And there is a note of thanks to you, Cody, for addressing the issue of contacting and updating folks without technology. That is a big issue.
It's huge.
Yep. All right. So moving right along, I noticed DHHS was in the news a couple of weeks ago for securing $2 million from SAMHSA. That's the Federal Substance Abuse and Mental Health Services Administration, to support the state's behavioral health response to COVID-19. And that's huge. North Carolina got the largest amount possible for a state. Can you talk about what those funds will do to help people out?
Sure. So again, so proud of my team. I mean, that grant came out, we were given a few days to respond, and they turned around, I believe, the best grant application I've ever seen for the proposal. So the team worked really hard to make that possible and to advocate. And what we did is, obviously the grant had some stipulations about what the funding was for and how to use it. We matched that up against where we saw the greatest need in that moment. And it boiled down to a few key things. First is for returning citizens and people who are being released from jail or prisons who are formerly incarcerated needing access to care. And so we had seen, I think all across the state, many local district attorneys and judges were trying to reduce the number of people that were in jail in local community jails. You know, we know that upwards of 70% of people in jails have a substance use disorder. It is likely that 40% of those people also have a co-occurring mental illness. You know, and so those are our people, right? And it has been my you know, challenge to our team for us to not just think about our systems of care, but to think about where the people are that we need to be serving and to build systems of care around them. And so in this situation, COVID-19 is pushing a lot of folks out of jail without any support or transition into community who we're going to be having a lot of issues with substance use disorder and mental illness, and us wanting to try to create some programming around supporting them. So we partnered quickly with organizations that help do that work. And so to try to, as folks are leaving jail or part of the folks that are being released from prison early, to get them connected to substance use disorder treatment, to get them connected to mental health care, to get them connected to some social services. And also, and this is something that we didn't have to use money for, but at least tied it in, is getting them connected to the state's non-congregate shelter program, which is essentially hotel lodging that is available to folks to help bridge housing for them as they're coming out of these places. So we kind of, once again, Christ the Trinity of actually trying to build a transition system that worked. And $2 million, when you try to stand up a transition system like that in a state of 10 million people, is a drop in the bucket. You know, it was just a start, but it was the right down payment in certain areas where we knew there was a lot of need, and we want to be doing more in that direction.
The phrase that keeps coming to my mind as you discuss how things are evolving is, necessity is the mother of invention.
Yeah, no, I think that's right. I mean, we've had to, you know, the flexibility that we have tried to give providers, and frankly, I'm inspired by the way providers have, you know, led in thinking about how am I going to keep in touch with my with my patient? How am I going to keep in touch with the person in my therapy group? How am I going to keep in touch with the peer who used to come to the peer living room? What are we going to do differently? And it's been our team's goal to frankly just get out of the way of that innovation, and make sure there's guardrails to make sure things are safe and maintain that responsibility, but to let people be innovative. And that's been really fun to see people rise to that challenge in such a beautiful way.
Wow, that's good stuff. All right, so one thing I did to prepare for our conversation this evening is to check out the DHHS website, and there are a lot of services that have been extended or expanded to help folks with the COVID-19 pandemic and all of the collateral damage, you might say. For example, I learned that DHHS is now giving an additional benefit of $257 to families with kids who would have received free meals had they been going to school. That's a pretty big deal. Are there any other hidden gems that people should be aware of in terms of support, things they might not know about?
Yeah, so actually our food program and also our child care program for essential workers, folks that have been having to, and that includes healthcare, child care workers, a very large list of essential, and offering that child care program has been one of the leading programs in the nation, and I think was just written up by the Center for American Progress as being one of the top 5 programs in the country. And that's that's had a huge impact on the staff that work in even our state facilities, right? All of us that all of a sudden had, children in the home who were no longer in school or no longer in daycare, who needed additional supports. This was a great program. So that has been wonderful. I mentioned a little earlier, a lot of the changes, and these are part of state government broadly, around unemployment insurance, waiving, the need for the waiting period to get access to unemployment insurance, waiving, making it possible for people who may have driven for Uber or Lyft and may not qualify for unemployment because they were contract employees, being able to get unemployment insurance. And then also for businesses, making it so that if one of their employees got unemployment insurance, it wasn't a ding on the business and a negative financial impact on the business. And so I think that's been huge. There's also been a lot of stuff that we've done in partnership with our local management entities, our managed care organizations, who have additionally done, short-term loans or grants to businesses to try to help sustain them, increased rates to help support individuals continue to get care and transition to telehealth. And so there's been a lot of systemic things. I think there's many, many, many more things we need to do. And I think this ties back into what you were talking about earlier, which is that there's still a lot of people in our state that are seriously impacted and hurting from this situation. And we're going to continue to work to find every way we can help them.
Right. Yeah, you touched on a lot of things that resonate. One thing that came to mind for me is friends I have who now, as you said, their children who would have been in school are at home and they're working remotely. So they might have deadline pressure and their kids either need tending to or they need help with their homework, which honestly, I looked at it, I think it was a second grader's homework assignments, and I thought, good Lord, that would take me a few hours to do. It's really a lot of stuff.
New math.
Exactly. Yeah, so do you have any words of wisdom for folks who are just dealing with these new situations? Maybe everyone's at home all of a sudden. They just don't have that headspace, those moments of silence that might have helped them get focused and keep their sanity a little more.
Yeah, our team actually put together a webinar that I believe we had last week, and then I think we're going to do another in a week or so on this issue, on parenting in the midst of COVID-19. And our child mental health team actually put it together to try to help support people in thinking about how do you carve out that time? What does that look like? And I think the first thing is, I think we've all had to learn to give ourselves grace. And I think especially with regard to interacting with other coworkers, I mean, I am on a call every day with the governor and Secretary Cohen as we do our morning briefing. And, we've gotten very used to children chiming in and adding to the discussion as part of that. And I think that in other work environments, that would have been like, you know, very almost bashful and embarrassing that someone would have done that. And I think we all have given ourselves a laugh here that that's just okay. This is the way that we're in life right now, and giving ourselves that space. I do think, and this is a thing that I want to encourage everyone to do, is that, you know, while I'm at the Emergency Operations Center today, I am working from home several days a week, and I'm learning how to be that close to my partner that often. But another key thing that's part of this is, you know, I'm going to stop working, you know, at some point during the day and turn off the computer. When you're working from home, it's a little too easy to kind of slide out of bed into your office and slide out of your office back into your bed. And I think we need to have a little bit more boundaries. And I think that's something that people who care about mental health spend a lot of time talking about. What are those boundaries that we can create for ourselves? And we think about how we create them in the relationships in our lives, but I think it's also important how we create them in our relationship to work in a physical setting as well.
Mm-hmm. Yeah, that's a really good point. I think for some people, implementing that structure in your own day is second nature, and for some of us, it is just hard. So yeah, that's a challenge for me personally, and for a lot of folks. But as I mentioned earlier, I do have a dog, so that sort of drags me out of the house every now and again. That's a good thing.
Yeah, I think there's been a lot of people getting dogs in the midst of this, and I'm a little worried. I hope that they keep the dogs, that they're when their socialized return. I want to make sure people are being serious about that investment. But I do think that there has been several conversations, I think, about the value of folks who have animals right now. It's really important.
Yeah, definitely good companionship. So, alrighty. So clearly this is a scary time for a lot of people, and we're not going to minimize that. And you have touched on this to an extent already, but what silver linings have you seen emerging these days?
Well, I mean, you know, I'll take one from a kind of system level, is that, you know, I wake up, work all day, and go to bed every day caring about the behavioral health system in North Carolina. I mean, this is why I'm here, and I know that everybody I work with has that same feeling. And I believe that if there's a silver lining, I'm having more conversations with people about the impact of this on mental health and the state of our behavioral health system in the first place than I have ever had in this job. And I think that the broader coalition of people who realize that this is real, that behavioral health is essential to health, is a really powerful breakthrough for a lot of folks. And people have thought about, I think, a similar breakthrough that happened with regard to the opioid epidemic and the criminal justice system, where people said we cannot arrest ourselves out of this epidemic. I think that people are realizing in a perhaps analogous way that, you know, when we have this many people that don't have access to care from behavioral health, and we have a massive pandemic event, you know, there's not a situation where your health is not my health, right? We are all in this together. And I'm hoping that we can take some of those truisms to continue to inform our policy decisions over the coming weeks, months, years, decades. On a more personal level, I think silver linings have been, you know, some people are finding what matters more to them, right? Moments like this, I think, and I know for me, it's been a clarifier to help me think about how I spend my time. There was I flew 52 times last year. I drove all over the state. There was probably not a week that went by that I wasn't traversing the state. I didn't keep the mileage count, but I didn't. And right now, I have not flown anywhere or traveled outside of Raleigh since January. And so for me, there's been a weird element of being able to be present in a way that I haven't been normally. And that's unique to me in this role, I guess. But I think that trying to find the positive things in all of our lives, whatever they look like, is a really important self-discipline and perhaps a coping mechanism.
Mm-hmm, mm-hmm. I have had a previous guest on the show say, this has pushed me to slow down, and that has been a blessing. That I was running and doing so much and always out, and it has been a clarifying era, and that's a good thing. So I definitely understand that. Absolutely. So one more question, we're getting close to our halfway mark. Does this era remind you of anything from the past, either globally or personally?
Yeah, I have unfortunately found myself, perhaps this is all my fault, I found myself in the middle of crisis response several times in my career, and it's usually always been natural disasters. We have obviously in the eastern part of the state back here, obviously we unfortunately in North Carolina have a rich history of responding to disasters. And then when I was living in DC, I spent a lot of time in disaster response with regard to snow, storms, and when I was working in the DC Department of Human Services. And so I think that obviously this, this kind of crisis response reminds me of that a bit. And the hours and the amount of effort and the kind of communication and the frustrations and all of that kind of goes with it is very akin to a almost like a battlefield-like experience. So that has been, trying to find the right balance there and take care of myself has been important, and try to continue to be at least decent boss and supportive leader of my team. I think to make sure that I'm not so focused on how are we responding to COVID that I'm not continuing to care and feed and lead, and that sort of stuff. So I think that has reminded me of those things, those past kind of other crisis experiences, which has also been powerful to draw on those experiences and remember what worked, what didn't work, and how.
All righty. Well, this concludes our interview portion of the show. And I love some of your insights as a good way to kick off Mental Health Awareness Month, especially My Health is Your Health, which Gail wrote in our chat box. I think that was a good memorable line. And just the idea that this is a clarifying moment in terms of lots of people realizing that mental health is essential to overall health. And that it's something we should be able to talk about easily, that veil of stigma and shame that really needs to be in the past. So
absolutely.
All right. Let's see, before we move to the video of the week, a big shout out to Michaela Leffen, who's helping out on the chat box tonight, and she also helps us with technology behind the scenes. Thanks also to our boss, who works endlessly behind the scenes, Executive Director Gary Kreitz. Okay, so now we've got a moment of fun for y'all. Our video for the week features NAMI North Carolina's mascot, Roxy. And she's been preparing for this year's NAMI Walk, or virtual events. Can y'all see that?
Yep.
Okay, good. And you can find her walk page at namiwalks.org/participant/Roxy Morrison. We'd love to have your video next week. If you'd like to see your video featured on Thursdays with NAMI, please post it to our Facebook page or send a link to the video to mail@naminc.org. Here's Roxy Morrison, still training diligently for our virtual NAMI Walk. And I have no idea why
NAMI
the
Walks
sound
Your
isn't
Way
coming through.
event
This
is May
supposed to
30th,
say
and we are really jazzed
Roxy Morrison has been preparing
about
for our
participating
NAMI
with
walk
videos, participating
all
with
spring,
It's coming through.
good thoughts,
Oh, it is? Okay, thank you.
participating by being on a team and doing whatever you can to make this virtual walk work for you. Roxy knows that as the mascot of NAMI North Carolina, she's got a big job, big responsibility, and she's been walking the walk, not just talking the talk. Come here, Roxy, let's have a look at your pretty face before we say goodbye. There she is. Hello. Alrighty. Please sign up for our walk. Help us out.
All right, so now everyone can say that you have met NAMI North Carolina's official mascot, Roxy Morrison. All right.
So fun.
Yeah, that's our moment of fun. That's our built-in lighthearted moment. Okay, so now we're in the last leg of our program. Send us your questions, and Deputy Secretary Kinsley, AKA Cody, will answer them. If you're wondering how do I ask a question, it's very simple. You want to look on the bottom of your screen for the icon that says Q&A. Once you click on that, a window will open and you can type your question right there. Then it will magically be delivered to us. And we'll get as many questions answered as possible in the time we have available. We will end promptly at 8:30 though. All right, we've got 4 here. If you typed a question into the chat box and we don't seem to be getting it, please type it again into the Q&A. All right, so number 1, the recovery community rallied and filled the gap with virtual peer recovery mutual aid meetings. An unintended positive consequence of COVID-19 will be the retention of these digital resources, affording people in recovery more choice and support. When do you think in-person mutual aid meetings, such as AA, Alcoholics Anonymous, and Medication Assisted Recovery Anonymous, can get back to normal with coffee and hugs? And that question is from Don McDonald.
Hey, Don. I think that goes back to that crystal ball that I don't have. I mean, I do crave personally and professionally for us to be able to get back to some semblance of normalcy and trying to create those spaces. But I still think it's going to be hard for a while. I think especially you kind of got me stuck on the hugs one. I have to recommend that you stick to what I'm saying right now. It's not a time for hugs, it's a time for jazz hands. And so you kind of got to do other greetings from afar. And I think that's probably going to be that way until we get to the land of the vaccine. Right? We may even be able to get where more people are congregating together at a distance with hygiene measures, but to protect yourself and more importantly, to protect someone that has a compromised immune system, it's important to not spread the disease, right? I think that's an important thing that people often forget is it's not really about you as much as it's about not passing it to the other person who may be particularly vulnerable to the disease. And so that is hard, but I think we've got to get back to that type of normalcy. I think we've got a long road ahead of us still.
Right. And you can also do the air hug. When I have a friend who every time we see each other, we do air hug, and it's kind of ridiculous, but at least it acknowledges, our mind is in that place and our spirit is in that place.
That's totally right. I like air hugs.
So, and Don put his name in the question. That's why I read it out loud. Typically, I assume people want some anonymity. Has there been any development in bipolar disorder treatment? That's kind of a tough one.
Yeah, I don't have the most recent data and science in front of me as far as where things are on treatment strategies, but happy to kind of get back to folks and look into that and see where the team is. So that is a hard one. And I know that there's not been anything particular to COVID where we've been able to try to tackle that. But it's a good question. And I think it also drives the point that we need to continue to invest in where are the evidence-based treatments for mental illness, and how do we continue to help support the development of that and making sure that that's being used.
Right. Good stuff. All righty, next up. Are there any special measures in place for people to obtain prescription refills on medications for mental health, i.e. it's harder to get a hold of doctors, organizations during the stay-at-home period? That is true.
Yeah, no, that's a good question. I know that recently we changed Medicaid rules to allow for pharmacies to be reimbursed for shipping meds, which was actually the kind of longest pole in the tent, if you will, that we had been hearing, that people could, often if you call your pharmacy, they will fax a request back to the doctor to refill the medication if it's a routine medication. I know that with some types of meds, there's some more complications involved. But what we had been hearing is that folks could actually get a hold of their doctor, but it was hard to actually then get their meds. They didn't feel safe going to the pharmacy. And so I'm hoping that shipping element helps a bit and will continue to make those refills more accessible.
That sounds like a lot of good solutions going on. Good questions tonight, virtual studio audience. What new or existing mental health services should be promoted and actively marketed to help families and individuals who are in crisis as a result of economic and relational pressures that come from the pandemic? I wonder about an upswing in domestic violence, substance use, and child abuse.
Well, you can put your wonder into certainty. I mean, that we know that the evidence not only shows in the science, but also in what we're observing kind of anecdotally as data comes in, that we are seeing an uptick in out-of-home placements for children. We're seeing an uptick in domestic violence issues or intimate partner violence issues, and of course the stress of all the things that we've talked about so far, people being together for long periods of time, people losing jobs, having issues with their ability to sustain their home, are incredibly stressful. And knowing that that was coming was part of the reason why we very quickly launched our Hope for North Carolina, Hope for NC helpline, that we wanted folks to be able to call and make access to. Some of you may be familiar that this line is the one that we have launched in response to previous natural disasters in Eastern North Carolina, and we decided that we were going to launch that statewide to give folks a place to call and to get access to the right resource for them in that moment, right? We wanted to kind of provide access to a tailored approach. And, to bore everyone with a few details behind the scenes, normally the funding for those sorts of things happens after the disaster, and we were able to kind of cleverly move some things around to get it on the front end. And so that's what was enabled us to stand that up. And we announced recently another grant that we were approved to apply for from the federal government that we're going to then chase to fund that. Because I'm really, my desire is for us to stand up a statewide crisis response, grief response, supportive response infrastructure that not only takes calls, but makes calls, proactively reaches out to folks, follows up with them, gets them connected to resources, helps them normalize the event, helps them talk about what's going on, and then helps them get connected to more serious and intensive resources if they need, and to do that for a year, if not more, right? I see this as a really an opportunity where we're going to have to invest for the long haul for this. And we have done this in the eastern part of the state as part of the hurricane response, where we actually sent people out door to door, knock on the doors of communities where people were impacted. And obviously we're not in a place where we won't be going door to door right now, but we'll find other places to connect with folks until we can go door to door.
Right, right. I love the emphasis on follow-up there. I know our connection groups, which is a mental health support group for peers that NAMIs do in Wilmington, they had a lot to talk about after Hurricane Florence, after all the weather-related difficulties out there, and it lasts a long time. So I'm so glad to hear you say that.
Well, in just the Hope for NC program in just Eastern North Carolina, we touched 275,000 people in the course of the year of that program. And I just love this program because we hire people from the communities. We send people out 2 by 2 with a licensed clinician and a paraprofessional to work together, to go door to door and to do that work and to build those relationships. And I don't know, one of my favorite TV shows is called The Midwife. And so I'm maybe mildly inspired by the point in time where we had community health workers who really went out, and we still have community health workers, but not as many as I would like. And in my way, this is a way for us to stand up a on-the-ground community mental health workforce that helps support people not only respond and move into recovery, but potentially begin to build resiliency towards traumatic events like this situation.
Right, right. That show is on my list. I haven't watched it yet, but
well, there's like 8 seasons, Peck, so you can really power through right now if you want.
Absolutely, that's my kind of binge. So, all right, here's a question. You have been a voice on a national level as well as in North Carolina. What areas in which NC is ahead of the curve in behavioral health? What are areas in which North Carolina is ahead of the curve in behavioral health in comparison to other states? And what areas, if any, are we needing to play catch up?
Great question. So I think that, I've been staying really close with my counterparts in other states, especially in our region. We actually had a call with the head of SAMHSA today. And so we've been coordinating, and I've actually been really proud of the collaboration across all the states to try to, this is not a time where we need to have 50 different people trying to figure out how to do something, right? This is a time where, we can break up, 10 of us can do one thing and share the idea, and then, and kind of get some more bang for our collective effort. And so that sort of sharing has been really valuable. I think some of it's because of the design of our system, but our public managed care structure with our LME MCOs enabled us to move really quickly, and enabled us to free up resources that were available to us in the risk reserve that is not available to more state-run mental health systems, and also frankly not available to us in private managed care organizations in the same way. And so being able to move quickly there, I think that we did a good job in early on putting out a document that said, here are all the flexibilities that we plan to bring to bear. Here's all the financial flexibilities we plan to bring to bear. And here's our who we're working with to do it. And it didn't have all the details. I think that was the next call I had with consumers and providers. Well, what about this? And what about this? And what about this? People held my feet to the fire. But that was what we needed, right? We needed to say, here's the vision document of where we're headed. And then frankly, our partnership with consumers and providers and LME MCOs who, peppered us with questions, drove us to get it there to where we needed to be. I think where we have been behind compared to other states has been in that we are playing catch up, in that our safety net for behavioral health is so historically underfunded, right? We have been this past year about $276 million worth of state funding went into that safety net with 1 million people uninsured. $276 million for 1 million people that are uninsured. That's $276 a person. And that doesn't get you nearly as far as you need to be. That's not a crisis visit. That's nothing. And so, so we've already been stretching that, very, very thin. And so trying to play catch up with those problems has kept us behind in really being able to continue to serve. Providers, what that means is providers were already on razor thin margins. The system was already incredibly stretched. There was no time for there was no funding for extra admin staff in the provider's office already. It was already a one person show. And so there's a lot of problems that I think that put us behind the 8 ball, and why we're still trying to catch up.
Sure. That always brings your attention when you have a crisis, and suddenly you realize, oh my gosh, this is what I need to do. I happened to break my leg in November, and I realized, gosh, I could have cleaned my house when I was feeling good.
Right.
I had to let some things go, and it's like, no. Question, silly analogy, but it works. Question from the chat box, rather a broad question. What resources are available for consumers and their families right now?
Well, that's a big question. I think that the first thing I would do is to tell folks to give us a call on the Hope for NC line. That's 1-855-587-3463. And I will type that into the chat box so everybody can see it. But I think that that let's have a personal conversation with our Hope for NC folks who can try to help get people connected. Of course, if you're in a place where you really want to talk to someone, the Suicide Prevention Lifeline is also available to folks. But we'll work hard to get people referred to services. And as I mentioned earlier, we have a lot of providers right now who are really, really hungry to take clients. And so this may be the perfect time where if you're comfortable doing it over the computer, and I assume everybody watching tonight's comfortable with the idea of maybe talking over the computer, this may be an opportunity to start a therapy relationship to get the support that they want via telehealth. I realize that's just one very small piece of a broader array of mental health and substance use disorder services. And that's why we're working with people individually to figure out how to meet those needs as best as we can.
Right, absolutely. All right, we've got some questions coming in. You addressed that. You gave us the NC crisis line number. What kind of improvements within behavioral health in North Carolina can be realistically expected because of the pandemic?
I'm sorry, can you say that one more time?
What kinds of improvements within behavioral health in North Carolina can be realistically expected because of the pandemic? You kind of touched on this earlier.
Yeah, I mean, well, we've talked about telehealth a bunch, so I won't double down there. I mean, I do think that I'm hoping that the second thing it does, and I think that I thank NAMI for its leadership on this always, is, as you said, lifting that veil of stigma. It's put this topic of social isolation, fear, and anxiety to the conversation that's happening at home, happening virtually in the workplace, right? So I think that being able to lift stigma. I think the third thing that I'm hopeful of is that employers will also take this seriously, right? Employers who, most people in our state have their health insurance via their employer, right? So if their employer says mental health is a priority, their health insurance is going to invest more in that. And if their employer says, I want a workplace that prioritizes mental health, then they'll be able to support folks in a way that's much better. And so I'm hoping that those are some of the positive things that we'll see out of this, and I'll use my voice and my team's push to make sure that we can help prioritize that. Of course, the big wish is that we not only see those efforts, collective efforts among employers and among our communities around stigma, but that we also see our legislators step up and prioritize behavioral health, and for us all to partner together on policies that are much needed and far forgotten too often, that to bring forth serious change for behavioral health in this state.
Yeah, absolutely. I'm going to read out the suicide hotline number since Cody referenced it. It's 1-800-273-TALK, 1-800-273-8255. That's a good one to keep in your phone. You never know when you'll need it. Couple nice comments from the chat box. I'm impressed with your efforts. Thank you. The resilience officer and Dr. Cohen all have been stellar. That's a great word, stellar. Our harm reduction legislation is model. A few comments about Medicaid expansion and how nice that would be. That is definitely true. What else have we got? Okay, there's one more. It's a comment, not a question, in the Q&A. Oh, I have to read this. Cody, you're awesome, from the chat box. I know it's been a long month today. I encourage carbs and Netflix tonight.
Yes, I'm definitely, I welcome any show recommendations, because I'm definitely in my unplugged mode of getting onto Netflix or any other streaming service. I'm exhausting my normal go-to shows. So if anybody has recommendations, shoot me a note. I would love to hear them. Tweet at me.
Someone just wrote exactly what came to my mind, a show called Upload. I believe it might be Prime rather than Netflix, but it's wonderful. Upload.
Okay, I haven't even heard of it.
It's unique. And The Wire, classic old HBO show about cops and drug dealers and schools and politicians in Baltimore, Maryland. Fantastic show with Idris Elba. All right. So I'm a little too knowledgeable about this stuff.
I love it. You're great. You're my call from now on when I need a Netflix recommendation.
I'll be there. All right, here's a comment in our Q&A. I feel like the stigma of mental illness has been lifted during this time. New Hanover County Public Schools has made it a priority to offer mental health support for all employees. Hopefully this will continue into the future. All right, thank you for that.
Well, I'll just share, Peg, that I grew up in New Hanover County and went to New Hanover County Public Schools, and so if I had my first experiences talking to a school counselor about my feelings and mental health issues when I was there, and so the thought that maybe we're using this moment to try to push forward there is really heartwarming for myself from a personal perspective, and I do hope that it will lift this veil of stigma. But I think it will come back to all of us, that we can make it easier to talk about, but then we have to change the systems that actually make it easier to be, right? I think that we have to remember that years of stigma, decades, forever, millennia of stigma has made it so that when you are sick with a mental illness, you are likely to fall into a place where you cannot afford treatment, right? I say that mental illness and poverty are unfortunately often co-occurring. We have a system that then often for folks, especially people with substance use disorder, end up in jail.
Mm-hmm.
They end up in a place where they can no longer apply for work or keep a job because the system has been designed in such a way that stigma has been rooted into the job application process. Stigma has been rooted into, when you are having a mental illness and a potential psychosis or specific issue outside, and the police arrest you because their belief is that you are being a public nuisance and you're really having a healthcare emergency. The system has been designed with stigma in mind. And so what's important for us is that let's all leverage this moment together to be open, to talk about what's going on, to celebrate that we're seeing the window open a bit in stigma, and then get ready to push as hard as we can to say it's not just enough for us to be able to talk about it. We need to change the rules of the game so that stigma does not hold us back at all these other steps, because mental illness, substance use disorder should be treated as diabetes and heart disease, where we would not put my grandmother in jail and never let her have a job again just because she didn't take control of her diabetes. That's, I think, the big push for us around stigma. I do think that opportunity is.
Yeah, that's a great example to point out the disparity in the way we treat these things. Absolutely. Yeah, a lot of work to be done. I do see a lot of progress too, though. I know, for example, my mother wanted help for depression and anxiety in the 70s, and they gave her Valium, and she couldn't function with that. She had 6 kids to run and never told anybody that she struggled. She just told me that little bit of information about her medication challenges. Fast forward 30 years, and I pulled a bunch of people together for a baseball game, one of whom was a man who lived with schizophrenia and was very open. My mom was one of those people we never shared stuff with. And there's Richard just telling her very nonchalantly, well, yeah, Mary, I've lived with schizophrenia and I was homeless for a while. And he just put it all out there. And her answer floored me. She said, well, Richard, I understand just a little bit. I've had anxiety my whole life. I have postpartum depression. And I had never heard those words out of her mouth. I feel like her seeing, the Oprah show, people starting to open up and having someone she didn't know put so much out there. And finally, at a very old age, she had permission to share that with somebody. So I kind of dropped my teeth.
Yeah, no, and that's beautiful, and it is very heartwarming to know that progress is being made, and that we'll hopefully be the ones to take it from where it is today to continue to push to where we need to be.
Absolutely. So virtual studio audience, we've got, I think we've covered everything in the chat box, and I don't see anything in Q&A. So we're getting to that moment of speak now or forever hold your peace. I am seeing more kudos for Cody and the efforts of DHHS Behavioral Health. You are awesome. There's so much going on that is positive and that generates a sense of behavioral health community action. I really like the wording of that because I don't remember at what point I started thinking in terms of there needs to be a civil rights movement for mental health, but that's a really appropriate way to frame that. So thank you for that comment. Okay, one new message. I think this is on the Netflix piece. If you want a great series of documentaries, go to visionaries.org. So I think I won't read the whole paragraph, but thank you. That does sound very good. And we're getting more thank you. So I think perhaps it's time to wrap up. Another program has flown by. I want to thank you all so much. And thanks to our special guest, Deputy Secretary Cody Kinsley, for being with us tonight. I knew they'd do that. I knew I'd do that. I wrote Deputy Secretary on the script.
I get Deputy Secretary quite often, so it's okay. I tell people I respond to Cody, Corey, and hey you, so it's all good. And Peg, thank you for having me. Thank you all again. It truly has been a good coping mechanism for me to be with you all tonight, to be able to connect with folks and to get outside of the grind of the COVID response in a little bit, and to talk about how things are going. And my heart is warm, and I am hopeful that we will continue to push forward in the way that we need to. So thank you all so much.
All right, well, I think that's a wonderful note to end on. And just as a way of saying goodbye to our virtual studio audience, please be well in the week ahead and observe social distancing. Do whatever it takes, go wherever you need to go, and be safe. All right, and that's the end of our show. Thanks, everybody. Have a great night.